Good morning and welcome to Community Focus. I'm Faith Daniels, and we've been talking to a variety of health organizations for quite a while, at least over the last year, and we've been consumed with the pandemic. We've been consumed with vaccines, getting COVID tested. But one of the things that we really need to get back to, and that is the regular maintenance of our community. And when we talk about regular maintenance, women go to the doctor because we have things that we just need to have checked on regularly. But then men, you know who you are. You develop a syndrome I call the Superman syndrome, which means you get to a certain age and you feel like you're just over it. You're invincible. And it's just an ache or a pain here or there. And it really doesn't bother you, but you probably should get that looked at, or you should just take better care of your health. Period. Well, I'm being joined this morning by a couple of gentlemen who are going to get us engaged in doing just that. Welcome to the conversation, Mr. Greg Hopkins. Thank you so much for joining me today.
Thank you for having me, Faith.
Well, you are the executive director of the community health centers. Give us a little background on community health centers.
Sure. Community Health Centers Greater Dayton have been around for 13 years now. We started with 3 centers that are very well known, Charles Drew, East Dayton, and Corwin Nixon Health Centers. And now we have six centers total. We've added Alex Central, Patterson Park, and Victor Cassano Health Centers. We provide medical, dental, behavioral health services to patients regardless of ability to pay.
Now, when you talk about patients, now that's a wide audience for us.
Mm-hmm.
That's a wide audience. So tell us, who can be served by the community health centers? Because people are thinking, well, I can only go there if I don't have insurance, or I can only be serviced there if I live in the neighborhood. Tell us who your audience is.
I'm so glad you asked. Our service area is technically Montgomery County. However, we have patients from outside the county as well who are more than welcome. Anyone from, we call it cradle to grave, is welcome to be seen. We have pediatricians, we have family practice physicians, we have internal medicine physicians who see only adults. So all ages, all walks of life, we gladly accept any insurance, but most of our patients have Medicaid. A lot of them are on CareSource as their source of payment. We do accept uninsured as well on a sliding fee scale.
And when we talk about that, everybody at this point has been insured, or we're close to getting everybody insured in the community. And when we talk about on a sliding fee scale, do they need to make arrangements in advance to figure out what their cost is going to be? Or is there an intake process when they come into one of the community health centers?
Sure. So we see patients by appointment, and it's really simple. We have a call center. You can make an appointment with any of our centers by simply calling 937-461-6869. And if you're not already a patient, we can get you signed up to become a patient of ours. We are a medical home, so we do want to see patients for all of your needs, as opposed to one time and never see you again. We can do that, but we really prefer to become your medical home.
And let's talk about that. We talk about following patients from the time they begin with your organization, with the smaller programs like the Help Me Grow and, the babies and moms programs that speak specifically to helping the family grow. And this should be a family connection where the entire family has an opportunity to be seen at one of your health centers.
Exactly. And we do have several generations of families who have been seen at our centers. We have patients who tell us that, oh, I know that doctor. I know her since she was born. I've known her.
That's beautiful.
Yeah, I've known her before she was a doctor. So that's great.
Oh, that's beautiful. That's what it's about. It's about building community. And let's talk about that. Building community. Before we got on the air, we talked about how women are consistent in hopefully maintaining our health care. And then we have men that after they're kind of under their mother's care, the mom making appointments for them, the mom making sure that they are engaged in knowing their bodies, knowing what's going on with their bodies. Once they hit that 17, 18-year-old mark, they kind of take the way of, I'm good, I'm fine, it's nothing. So talk to us a little bit about your new initiative.
Sure, you nailed it, Faith. So we have data which shows, every year, any state in the country, you name it, it's not just unique to us here in Ohio or in the Dayton area. Boys and girls will come to the doctor at the same rate up until about age 17. After that, us guys no longer need our sports physicals. Okay, we become invincible. Testosterone.
That's that Superman syndrome I talk about.
What's that?
The Superman syndrome, that you're invincible.
Exactly, you got it. So I'm guilty as well. I'm a little over the 18 age now, but there was probably a stretch there when I was 18 to 28. I did not see a doctor, so I get it, but it was wrong, and I should have, And then what we know from all the data as well, men die before women. We die sooner. So I believe there's a correlation, but we're trying to do something about that.
Absolutely. Let's talk about that correlation, because especially in the African American community, we have men that die at a rate much faster than any other race. And when we talk about, and we will exclude it just to health issues, because they are diagnosed later, because they are acknowledging whatever their health challenge is later in life, that leads to a later diagnosis and, a much, much greater chance of them becoming a fatality because of that diagnosis. And we're hoping that this initiative will raise awareness and get men out of that square of I'm good to I'm good, but I still need to know my numbers. Does that sound about right?
That's exactly right. So it's the Men Know Your Numbers campaign. And we have been partnering with Molina Healthcare over the years on men health fairs. So we were conducting health fairs the Saturday before Thanksgiving, and the incentive was frozen turkeys. We would give out a frozen turkey to any guy who showed up at the health fair. We had wonderful vendors there, great information, fantastic speakers. But after a few years, even the guys get tired of that. And actually, the pandemic last year forced us to rethink our approach.
Wow.
So fortunately, Molina reached out to us at Community Health Centers of Greater Dayton and said, hey, how can we partner even better with you all?
Sure.
So we told them about this fantastic idea we have of having sports celebrities who have ties to the Dayton area speak to men in the form of a public service campaign. And
awesome.
The idea is that, when I played sports, my numbers were this or my stats were that, but the important numbers now are blood sugar, blood pressure, cholesterol, PSA levels.
There you go. And you noticed I was counting right along with you.
Yes.
I was counting right along with you, because when we talk about that PSA level, when we talk about high blood pressure, and when we talk about anything associated with what is considered to be a quote unquote African American men's challenging health disparity, they've got to pay attention. They've stroke, heart disease, go right along with hypertension. And then you've got diabetes that is creeping right around the corner. And those are things that we really have to address.
Sure.
When men get sick, we make fun of you guys a little bit, because you get a cold, you're on the couch for a week, and, we've walked around, given birth, got up the next day, and then still drove carpool. But one of the things we have to do as women is be encouraging, be engaging, and definitely be a part of the process of getting our men to the doctor at a much, much higher rate. Well, let's bring Chuck Vela in. Chuck, welcome to the party.
Thank you. Nice to be here.
Well, my pleasure to have you join us. Tell us a little bit about your engagement in the process.
Well, Greg, I own a public relations firm called Vela Inc., in Dayton, and I've done worked for Greg for community health centers for several years, kind of off and on projects, and they were unrelated to the subject at hand at that time. But back, we think about 4 years ago, 3 years ago, we lose track of time easily. Greg had an idea about addressing the issue of men and not taking care of their health care. And so he developed this idea, and it's Men Know Your Numbers. And the idea is to employ professional basketball, professional football, Olympians, Daytonians who have a track record in Olympic or professional sports, and they talk about their numbers when they were involved in their athletic endeavors, and now that they pay attention to a different set of numbers, and those are the 4 measures and other measures as well that Greg just mentioned. So we have a campaign that is launching probably Monday or Tuesday of next week. And we think it's a fun campaign too. We're not being preachy. We're going to have some fun with it. So that's what I've been doing, is help manage that campaign and bring it to life. And Greg can talk a little bit more about the approach, and I can tell more about the details.
Well, let's jump right into the details since we're chatting. One of the things I want us to think about where the details are concerned is the fact that you made a significant statement when you said it's not preachy. And men will turn you off faster than anything if they feel like you have gotten on a soapbox with them. They just can't connect to that. And you guys have realized that. And you've taken an angle that I think is just outstanding.
And it's a lot of fun. I have to say that we really wanted to have fun with this campaign, and we think our spokespeople have had fun with it as well. And they've all reviewed the finished product, which, like I said, will start airing next week. And it's just very upbeat. I guess that's a good way to say it.
And that's what it's about. That is exactly what it's about. Because when you look at the men in the African-American community specifically, it's got to be fun. It's got to be engaging. It's got to get their attention without getting on that soapbox and wagging your finger at them. They know they haven't done the best about their health. They know that. And when we get together as a community, I am hoping that everyone will engage and support this in an opportunity to help every man know his numbers and in some cases save his own life. Absolutely. When we look at hypertension, diabetes, and heart disease in the African-American community with our men, and that PSA number with prostate cancer and how often they've gotten prostate exams, they pale in comparison to other races. Even if we looked at a schedule of how often men just had a physical. Mm-hmm. And I say that, and I have a husband, I have a father-in-law, I have, and brother-in-laws. So I know from a very firsthand place that without the urgency that we're putting on this, sometimes they're prone to let it go. They are prone to let it go. So Greg, how do we get our community engaged, involved, and ready to get excited and hit the streets with our men knowing their numbers?
Well, a couple of things, Faith, and you're right on target. It's sad, but sometimes we are better about taking care of our vehicles, our cars, than we are our bodies as men. The check engine light comes on, or something doesn't feel right or sound right.
You are straight to the garage.
Yeah, we'll get it checked out. But our bodies, we need to do the same thing, and even more so. So we have engaged probably 3 of the best athletes, former athletes from the Dayton area that everyone has heard of. So we have Keith Byers, and Keith is a Daytonian who played played football at Ohio State University. He also played high school basketball here as well, but he played football at Ohio State and then went on to a fantastic professional career. So Keith Byers is one of our spokesmen, as well as Velvet, Roosevelt Chapman. Roosevelt, once again, grew up here in the area and went on to play at UD, is still the leading scorer, all-time leading scorer of UD, and had a fantastic basketball career. And then probably the most well-known athlete ever in the Miami Valley area, Edwin C. Moses, is also a spokesman.
That is absolutely incredible. When
Yeah.
you engage these celebrities, they had to be excited about getting on board and not only just being a spokesperson for helping health, wellness, and awareness really reach the community, but their community, the community that supported them, loved them, and nurtured them into these amazing careers. They had to be excited about that.
And it comes through when you see the video. Obviously, we can't see that on the radio, but when the commercials air, it's obvious when you see their faces. And they tell everybody they are proud Daytonians, and it shows. And they did this without any pay. You know, they volunteered to do this. So
That's awesome.
kudos to them. And I have to also thank again our co-sponsor for this, Molina Healthcare.
Well, it's been our pleasure to get the word out about it. We're going to put the link back up again because we also want people to get engaged early. That means you don't have to wait to see the commercial to decide to go figure out your numbers.
Absolutely.
We want you to get engaged now. CommunityHealthDayton.org. That's going to lead you to the community health centers here in the Dayton and Miami Valley area. You can also call 937-461-6869. And if you've missed any portion of this interview, of course, you can catch it on our Facebook page or on our website at 921wrou.com and click the link that will be in the bio next to the video and get engaged. Help these men know their numbers because it's going to be an awesome opportunity to help us save the lives of those that do the most in our community. We need them, and we definitely want to be a part of this initiative. Gentlemen, thank you so much for joining me today.
Thank you.
Thank you.
It has been our pleasure, and we thank you for checking out Community Focus. I'm Faith Daniels. Enjoy your day.